the abdominal aorta in the abdomen. Okay, the competency-based undergraduate curriculum describe and identify the formation and course and relation and tributaries of portal vein, inferior vena cava and renal vein. This is one part. Now, describe and identify the origin, course, important relation and branches of the abdominal aorta, celiac trunk, superior mesenteric, inferior mesenteric and common iliac arteries. This you must know. It can come as a short question on MCQ. Now, vessels of the posterior abdominal wall. These are the main vessels. And see the abdominal aorta and its branches, inferior vena cava and its tributaries, cisternae chyli, abdominal part of azygos and hemiazygos veins. And the thoracic part, the question came in thoracic part. And the abdominal part is now will be discussed. Abdominal aorta, the vessels of the posterior abdominal wall, the abdominal aorta and its branches, inferior vena cava and its tributaries, cisternae chyli, and abdominal part of azygos and hemiazygos veins. Now, any book you or atlas you have, if you have an atlas, your book is sufficient, and you try to get the first today when you return to your hostel, you open the atlas or your tab, whatever mode you have. Okay. Now, see, this is the diaphragm. Now, this is the inferior vena cava, this is right suprarenal gland, this is the kidneys, and this is the aorta. And this is the this is the esophageal opening in the diaphragm. This is the kidney, the right ureter, gonadal vessels are here. And you will see on the celiac trunk, this is the celiac trunk. Now, this is the medial suprarenal artery, renal artery, and these are renal veins. Now, superior mesenteric artery. This is the superior mesenteric artery. And superior mesenteric arteries here. This is the lumbar arteries. This is gonadal arteries. This is inferior mesenteric arteries. Superior mesenteric, inferior mesenteric arteries. And this is the median sacral artery. This is the median sacral artery in the center, and common iliac artery. This is the common iliac artery. Now, why I am telling you, when you are studying, you have that picture in front of you. And if you cannot assess the photograph, then you draw it. I saw one of your friends practicing, because I landed up early today. Okay, some lumbar plexus or some your revision she was doing. Just beautiful, it's a schematic drawing, so you don't, like I saw, I corrected some papers. You are spending more time in the drawing. No, you have to convey the message. That I have been repeating since you came to this college. Now, list of the branches of the abdominal aorta extends from the aortic opening of the diaphragm till the body of the L4 vertebra. Measurements: length 10 to 11 centimeters, width 2 centimeters. 10 to 11 centimeters is this much. When the abdomen is open already. It will be in the table. So, whoever is telling you the day the teacher in charge, you please find some time in this 1.5 hours to go and see it yourself. No one will say you are, but don't tear any structure. Pachoda, from getting frustrated, no. It's all dissected. Only you have to just use a small forceps, and if you find it difficult, then you see and just dissector your atlas, you just compare and just go and get it into location of that spot. It can, see the superior mesenteric artery, it is there. But if you have anything, it might be a bit lateral or a bit medial, but it's in the median line. Okay. That don't get this thing mentally disturbed for this, and width is 2 centimeters. The width is 2 centimeters, this much. Now abdominal aorta, beginning continuation of the descending thoracic aorta at the aortic opening of the diaphragm opposite to the lower T12 vertebra. These are important, like in nerve supply. You have to know which branch comes from where. Okay. Now, now this is important, T12, continuation of the descending aorta, thoracic aorta at the aortic opening of the diaphragm, opposite to the lower border of the T12. Now, what you do, T12 up to sacral promontory, up to the sacrum. And when you are studying, you draw it in red like this. Then, now this is T12. Okay. Now, lumbar 1, lumbar 2, lumbar 3, lumbar 4, lumbar 5, whatever it is. Now it is like this. The superior mesenteric. Like this. You just label it. You just label it. And it will be easy to reproduce in your examination and descends vertically downwards and slightly to the left in front of the vertebral column. Termination by dividing into 2 common iliac arteries opposite L4. This is L1, L2, L3, L4 you will see. See, it distributes. So in this part from the opening, now you don't have to imagine, but at this step, now you have to imagine that what are the organs below the diaphragm. It is the liver, it's the spleen, the kidney, the suprarenal glands with it, and the stomach, duodenum, pancreas, and the duodenum, jejunum, and then your ileum, ileocecal valve, appendix, ascending colon, your transverse colon, descending colon, pelvic colon, then rectum and anal canal. Now, you see, the design is such, you have to, why I am telling you, the landmarks you do, more or less it is, then the bifurcates. At L4, see, this is it bifurcates the common iliac arteries. Now, relations of the abdominal aorta. See, anterior from above downwards and from anterior above downwards, on the anterior and above downwards. 1, 2, 3, 4. This whole location you have to know. You have to know the name of that specific artery, and you have to know that this is the mesenteric artery, this is celiac artery. That means it is supplying, this is the renal artery, this is artery to the pancreas, then this is the gastric artery, that is duodenal arteries. Then naturally the total, how you just go and drawing and then this thing and label it. And see, the celiac and aortic plexus, splenic vein, and body of the pancreas, third part of the duodenum, root of the mesentery, and left renal vein. This is relations of the abdominal aorta. Now, relations of the abdominal aorta, posterior, body of L1 to L4 vertebra and corresponding intervertebral disc, anterior longitudinal ligaments, and third and fourth left lumbar veins. Relations of the abdominal aorta on the right, inferior vena cava, this is on the right, and this is on the left, the abdominal aorta. On the left sympathetic trunk and left cross of the diaphragm. See the diaphragm is encircling the esophagus, the opening of the abdominal aorta, this is the opening of the inferior vena cava, and this is the crus. This over here. Now, see the openings. You have read the diaphragm. The question can be 4 marks, short question, or it can come into your MCQ. What are the openings of the vertebra? So, you have to imagine now, you have to think it in this form that the vena cava, the esophageal opening, this has to come down. The trachea doesn't come down, but the esophagus does. From your mouth, pharynx, oropharynx, pharynx, and then goes down into the stomach, the cardiac end of the stomach. Similarly, it's another schematic picture. Now you can see abdominal aorta. Branches of the abdominal aorta. Question, list of branches of abdominal aorta. This can be a question. List 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, whatever it is. When you are answering, now there are anterior branches and lateral branches. When you are remembering, 1, 2, 3, 4 करके अब remember करते हैं. But when you are producing in the Viva table, immediately don't say that 1, 2, 3, 4. Because you might be knowing 3, 1, 2, 3. You're naming it. See, I'm just to give you an example. This is the celiac trunk, superior mesenteric artery, inferior mesenteric artery. But when you say what are the anterior branches? Then you say 3. Don't say 3. Don't be specific in uttering the number of branches. You have to be very calculative. Now you say 1, 2, 3 means you don't number, but you say it is the celiac trunk, the superior mesenteric artery. Okay. Next. The examiner will go to the next question. Okay. If not, then you say the third. Superior inferior arteries. Here. Lateral branches. These are paired. These include following. The inferior phrenic artery, middle suprarenal artery, renal artery, gonadal, testicular or ovarian. Now see, these are paired. Okay. Now, there can be any abnormalities, but in your level, you won't be asked for what are the abnormalities. I'm telling you, see, now, inferior phrenic artery, middle suprarenal artery, renal artery, and gonadal, testicular, ovarian arteries. That means you are having these organs, okay. But kidneys actually stay when it is in the embryological state. The kidneys are in the pelvis. Now, the testes are in the level of the kidneys. The Maharaja, the testes, it descends and comes to the pelvis, and then it travels through the inguinal canal and goes to the scrotum. So, there can be a state that undescended testes, that we are used to use that term. Now, you have to say incomplete descent of testes. Even in undescended testes goes. Incomplete descent of testes. So, the testes, when you are, now I told you your one batch, I think, in your pelvis. Now, when the baby is born, if you are an intern doing duty, the baby is born in any by normal delivery or LUCS, or the baby is, you are a gynec surgeon, you just see, take out the baby and just, you don't, at that time you won't have time, but after you finish, please look for any anorectal abnormalities. If the septum is there or you pass stool, then all these things have to be correlated. And see, your incomplete descent of testes, the mother is the first person to show you. ये डॉक्टर साहब इसको देखिए, लगता है कि एक नहीं है, testis नहीं है. So sometimes what happens, that can be retractile testis. It pulls up and comes down, pulls up and comes down. And if the testis, if you do an ultrasound, if you're missing, then you might see a kidney in the pelvis, horseshoe shaped, or it might be normal kidney. That means that is supplied from the aorta. And the other, the right kidney in the pelvis, left kidney in its position. Now, what I want to stress is that, because you have to know and plan for this, but usually there is no way to pull up the kidney from the pelvis to the, no operative procedures. Leave it as such. It will grow as an adult. In routine ultrasound, we get people having kidney in the your pelvis and other kidney in normal position. Now, their vascularity will definitely, nature will adapt. It will supply the organ. Now, see, abdominal aorta, this is the celiac trunk. This is the inferior phrenic artery. This is the middle suprarenal artery, the celiac trunk, the superior mesenteric artery. This is the gonadal vessel. This is the gonadal vessel. These are the lumbar arteries. Okay. This is the common iliac artery. This is the inferior mesenteric artery. This is the common iliac artery. Median sacral artery. This is the median sacral artery. Now, branches of the abdominal aorta, list the branches of the abdominal aorta. Posterior branches, 4 pairs of lumbar arteries. 4 pairs. 1, 2, 3, 4. 4 pairs of lumbar arteries. Now, the median sacral artery, posteriorly. Terminal branches, common iliac artery and right common iliac artery and left common iliac artery. Now, critical integration, aortic aneurysm. Now, see the normal abdominal aorta. This is localized dilatation of the abdominal aorta, aortic aneurysm. Now, localized dilatation of the abdominal aorta usually occurs in infrarenal part of the abdominal aorta. Here, infrarenal. If you, the kidney is here, here's the kidney here. It is infrarenal, okay. Now, commonly in elderly men, those who are suffering from arteriosclerosis. Now, arteriosclerosis, now you can, when you examining the patient, you will palpate the abdomen. But when you are inspecting, you will be seeing something with the heart, the pumping of the heart. In that rate, the pulsation is there. Even in a obese person, if you get little, you can feel, but you have to palpate and relax the abdomen. Ask the patient to relax and see. You will get the throbbing. Okay. Then you, in ultrasound, you will be getting the image. Now, fatal rupture of the aortic aneurysm, if rupture is suspected in aortic aneurysm, it is fatal about 90% cases due to heavy blood loss. There are very remote chances of they'll die. Okay, if there is a rupture. But if it is not rupture, now you have to, what I do in my clinical practice is that this type of any vascular malformations or pathological condition, I take a stethoscope, I put it in the ear of the patient, then I take the right hand and ask the patient to feel the pulse, and the stethoscope I put in the apex beat of the heart. Now I tell her, can you hear? Dup, 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 dup. She says yes. Now, তুমি যেখানে হাত দিয়েছো, now in the wrist, your radial pulsation, can you feel it? Now these two, একই তো. There is no difference. That means you are seeing the pulsation there. Then that thing goes off from her head. And I explain that the heart is pumping blood to your head, whole body. Naturally, this is the way it goes on. But you are having a small problem, but you won't die. Only patient will, a thin lady will come and say, "Dekhun, dhap 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 korche, dekhu nahi dekhu." Then I put the stethoscope in the aorta and put the earpiece in the ears and ask her to hold it. Yeah, I just put it, I catch hold of the hand and see the pulsation. It's not written in the book. When you come, go to clinics, you see the patient. This is one thing, the abdominal pulsation, aortic aneurysm. Now, now pulsation of abdominal aorta. Now, pulsation of abdominal aorta in normal individual, the abdominal pulsation cannot be felt. But pulsation of abdominal aorta can be felt in the following tumors of structures overlying the aorta and aortic aneurysm. These are tumors of structures overlying the aorta. There can be many types. And that might be big ovarian cyst or big tumor, or from the posterior wall, some tumor is arising. It can be a muscular tumor. This is what you have to evaluate with your clinical knowledge. And you will be reassuring the patient. Then let's see, ami chobi tuli, I'll take some images, and then tumi chinta koro na. These things are missing. You won't be in a loss, because if you see 50 patients, I'm saying 50 maximum, you allow the patient to speak. So nowadays, now bolte parbe na. When a mother is saying, আমি থাকি, তখন আমি বললাম যে, doesn't she quarrel with you, fight with you for a phone? They just smile and laugh. I tell her, bhai tu ja to, ami dekhchi. Now, a wife came the other day, and the husband want to stay. But I have my sister, and I said, no, didimoni ache, ami dekhe nichi. Tumi baire thako. You stay outside. And again, I tell her, but before he leaves, I tell him, ঝগড়া করে না তোর সঙ্গে, এত বছর, কত বছর বিয়ে হয়েছে? 20 বছর। 20 years of marriage, you didn't have a quarrel, fight, রাগ, অভিমান। এটা একটা দিক। Okay, now, you see, the tumors structures overlying the aorta and aortic aneurysm. Now, inferior vena cava, that is not today's topic. Anyway, I'll just give you a glimpse. Now, inferior vena cava is the longest and widest vein in the body, and it drains most of the body parts below the diaphragm into the right atrium. The abdominal part, IVC, is devoid of valves. It is devoid of valves. The abdominal part of the vena cava is devoid of valves. Measurement 20 to 23 centimeters. Breadth 2.5 centimeters. Formation: inferior vena cava is formed by the union of right and left common iliac veins anterior to the fifth lumbar vertebra, above 1 centimeter to the right of the midline. Now, the course, inferior vena cava ascends upwards anterior to the vertebral bodies on the right of the abdominal aorta. It leaves the abdominal cavity through the opening at the central tendon of the diaphragm that lies at the level of T8 vertebra. The inferior vena cava enters within the pericardium in the thoracic cavity and opens into the right atrium. Termination: inferior vena cava opens into the posterior inferior part of the right atrium that you have learned in thorax. Okay, but veins carry blood towards the heart. Now, relations of the parts of the inferior vena cava. The inferior vena cava is related to the following structures anteriorly from above downwards: liver, group for the inferior vena on the posterior surface; epiploic foramen, first part of the duodenum and posterior portal vein; head of pancreas, third part of the duodenum; root of the right gonadal vessel; root of the mesentery; root of common iliac artery. This is posterior. The inferior vena cava is related to the following structures posteriorly from above downwards: right crus of the diaphragm, the right suprarenal gland, right renal, middle suprarenal and phrenic arteries, bodies of the lower three lumbar vertebrae, and right psoas major, right sympathetic trunk. This is the bare area of liver, hepatorenal pouch of Morrison, second part of the duodenum, right kidney, right ureter. On the left, caudate lobe of liver, lesser sac, right crus of the diaphragm, cisternae chyli, and aorta. Tributaries of inferior vena cava. The formative tributaries: right common iliac vein, left common iliac vein. Tributaries of the inferior vena cava, the formative tributaries. How it is formed? That's why the word formative tributaries. What is happening? The right common iliac vein, left common iliac vein, the median sacral vein from abdominal wall, inferior phrenic B from abdominal wall, inferior phrenic vein, third and fourth lumbar veins, C from abdominal viscera, right suprarenal vein, right and left renal veins, right and testicular or ovarian vein from liver, right, middle and left hepatic veins. Your hepatic veins. Now, this is the left suprarenal vein, right renal vein, this is the left renal vein, left gonadal vein here, left suprarenal vein, right gonadal vein, third and fourth lumbar veins, median sacral vein, right common iliac, internal iliac, internal left external iliac. This. So you make a card if you can, and or your khata will be sufficient. You draw in this form and try to now your all things, your aim will be in passing the examination. 60% my demand. I don't demand, in my life I have not demanded many things. But It is by God's blessing that I have got many things in this 40 years of medical career. Now, I'm telling you the way you have to handle. Of course, there are online platforms. If you are comfortable, you can do the things, but attend all the classes. So what you hear, that percolates into your brain, and if you go for an online platform, it's your wish, or you go for AI, you're struggling through any questions, you just, then that chat GPT. Okay, now, now this is the repetition. These interesting facts, you will get it in all books. If I now try to put this into your head, you won't carry it.